Hello everybody, good afternoon, it's your boy Ipros, popularly known as MLS, is a triple promise. And today we'll be discussing on a vital and very crucial topic today, which is margins of errors in healthcare practice, in our modern days healthcare practice. And today with me is...
Good afternoon, everyone. My name is Medical Lab Scientist Ajayi Ayo Samuel. I am a histo specialist. I'm specialized in cancer testing, using of IHC and some other sophisticated testing. Like you said, we'll be talking about that topic, and you do well to go along with us and sharing some of the experiences. Thank you.
Okay, thank you for coming, sir. So, today, speaking of margins of errors in our modern days health practice, we would like to, know how errors are recognized, managed, minimized, and how can we, healthcare practitioners like you and I and others practicing in other fields and learn from this.
All right. Once again, thank you very much. Just like we're saying, errors are not what we can be completely free from. But when you're not talking about errors in the health sector, then you're talking about a serious issue. Error in the health sector is not something to be trivialized or to just take commonly, because we're talking about lives here. So on anything that concerns lives, you must take it as a priority. Now, we have degrees of errors, and if in health sector what we're trying to achieve is errors that are even less than 0.01%, that is, we have 99.9%. And that 0.01% should be an error that must not be very implicative or very costly, that can affect lives. Where can you get errors from? Errors can come from different things that you use. Talking about, let's start from the manpower. If individuals are not trained or they are not getting adequate updates, it could be in any field. You can be a radiographer, you can be optometry, you can be anywhere. But if you're not getting adequate training, you cannot, you are subject to error. So we have margins of error. Like I said, what we're looking for in X sector, or what every profession is looking for, something that should far less than 0.01% of error. So by Levy-Jennings chart, if you do that in your facility or your procedures, you will be very used to identifying errors and seeing your margin. And once your margin is shooting out of that, you quickly come to look at your controls, look at your calibrations, look at your reagents, standardize again. So make sure that, and run, at least just run a lot of controls so that you can have your margin very close as possible, so that you don't start giving us results that you think are normal, but on the other patient side, they are not normal. And some of them are significant that the patient has to be, you're subjected to some treatment or some conditions, or has to be giving diagnoses that are not pertinent to them. Thank you.
Those all these things now, the people working or working on various samples, just like you said, in your own aspect of field now, the humans. So how is staff competency ensured to minimize error?
Okay, yes. Coming down to my field, like I said, I am a histo scientist. I've been practicing in my field of specialty for about 15 years now, working on testing tissues and cells for cancer diagnosis. Now, how is it peculiar to my field when you're talking about eradication of error? Just like we said, if you must identify your source of error, so that brings you down to a holistic approach, whereby you can divide your laboratory or your process, we call it process control, into like 3 parts. You're talking about pre-analytic, your analytic, and also your post-analytic. So if you're looking at everything generally, sometimes you can miss out. So but by the time you divide them into these 3 aspects, your pre-analytics, in my field, pre-analytics is coming from right from theater, where you're taking your sample from. Now, if from the theater, the sample, the tissue, the surgery is done, and sometimes, you have surgeons conducting an operation, and they've removed, excised maybe a particular part of the organ or tumor or tissue. Sometimes, maybe out of curiosity or out of their function and everything, they go carried away, and they're still working on the patient and everything. But somehow, the most important part of that operation has been left behind. Like the sample, sometimes being kept on the bench or on the couch or on the trolley, unattended to. The sample is as important as that patient, because it is still that sample that will tell the whole story of that patient. So it is, by the time it's not unattended to, the ischemic time has started kicking. That's what do we mean? There's no more oxygen in that sample. So once there is no more oxygen is cut off, it has been removed, no veins, no blood supply. The cells there have started changing in terms of their physiology, their morphology, no more oxygen. So that shows they've started dying. So if you don't attend to those samples accordingly at that time, error has started happening. So don't forget, by the time you bring that sample to the lab, you want to see that sample representing that patient, exactly what they are looking for, exactly what they are talking about. So if the sample is fixed properly, you may not have that, because the sample will still have what we call lifelike. That is, it's still the condition of those cells as in the body of the patient. So everything you will be doing in the lab will be corresponding to a lifelike, as if you are testing cells that are alive. So while we're talking about that, we'll now start talking about right from the fixation, the sample, where you keep the sample. Sometimes you see samples coming in hard bottles, cover bottles that are, different types of, there is prescribed containers, so that samples can be free in the container when they're, being fixed. And there is a volume to that, whereby, the volume of the fixative to the sample, you must keep it at least 1 to 10. Sometimes you can make it as much as 1 to 20, so that the sample can be well perfused with the fixative. Your sample should not be resting on your container. If it's resting on the container, that means the whole part that is resting on the container will not get fixed. So autolysis will set in, you won't get any tissue, any cell from those areas. Remember, we are testing cancers. So, and if you didn't see the cell, how will you know if it's cancer or not? So now, coming to the lab, we're now talking about the analysis. When you open it, you describe it, you do this and all that. We'll take it through different processes. So all the processes that we go through, right from processing to embedding to microtomy to staining, are quality control. What do we mean by quality control? That each of the processes have been standardized in terms of the machine, the personnel, the reagent, the timing, everything has been standardized. Due by experiment, then we'll now adopt the standard processes which we are using to operate based on the condition of our environment. What you may have here may be different from what you have in Egypt, maybe even be different from what you have in other parts of Nigeria. And so it's by standardization. This is why it's so important, even in my field. And we do a lot. We train our staffs, we train our colleagues. We do a lot to make sure that we eradicate errors. Like I said, 0.01 is not even acceptable. If your laboratory is error-free or your practice is error-free, the better it is for you. You can sleep with your conscience. Thank you.
So having said all this, how, errors can be avoided, managed, and how we can learn from it. So now maybe let's go down to your own field of practice as a, chief medical lab scientist. Now in your own, field of practice, what are these, little errors that, that can be avoided or help healthcare practice?
All right, thank you very much. A very good question. Must be sincere with you. And with practice, what we do is most people try to cover up their errors. And the Holy Book says, if you cover up your sin, you will not prosper. And yes, that's the reality. So if errors are made or errors occur, it is good that we communicate. And there are processes for communication. I am an employee here, like in my institution. So if I make error, there is processes that I must go through, or the information must go through. I cannot just go to a patient and tell, oh, patient, I'm so sorry I killed your patient. Or I go to a relative, I'm so sorry I misdiagnosed you. No, that's not how it is done. So because you might end up communicating the information wrongly, and the perception will be wrong. So it is very important that the management of the institution, the management of the system, be well carried along in every error processes. Normally we have incidences report, so we have panic values. So some of these things are communicated, either reported like weekly, monthly in department meetings, thereby they are now communicated up above to management, and some of them that management needs to take up, maybe to further, or maybe to the regulatory bodies, or to the ministry, or to whatever, then they cannot be taken up if they are so severe. And they will be communicated in appropriate fora with the client or with the patient. So, but individually as health personnel, it is not advisable that you communicate directly or you relate with, you must go through the appropriate bodies so that all stakeholders involved can be carried along in the communication, so that no error will be committed.
So what are your advices to other healthcare practitioners out there, actively practicing? You understand, like I said, be it a doctor, a nurse, pharmacist, med lab, radiologist, but be it whatever healthcare practitioner currently and actively practicing, what are the general advice you can give? Because this is a very crucial topic that goes across all healthcare professions. So what are your advice? What are those key advices you can give them while they are still actively practicing?
All right, thank you very much. Yes, one thing we must continue to remember is we may be okay today. Tomorrow you will be a patient, definitely. Tomorrow some of us will still come up with some health challenges that you will need people to help you with, either your testing or your surgery or your drugs or anything. So if you continue to make errors and you make it your daily lifestyle, so at the point when you come to that point in your life too, your conscience will prick you that those things I used to do, like maybe you don't clean up your bench very well, you don't take protocols, you don't use standardized manuals, you just do anything anyhow, will start ringing your mind that somebody may be crazy there doing the same thing like you're doing. And definitely what the kind of things that you are dishing out, maybe times of practice and everything, will happen to you. So it's start pricking you from there. So we must carry our conscience along as professionals, and we must always take consent from our clients or patients.
Thank you for your presence once again, Mr. Ayo, our Chief Medical Life Science. So having heard this, it is safe to say that healthcare practitioner is not a field of where we say error due to parallax, or it's not a field of practice of whereby you say okay minus this or this 0 to 0 to this. I don't know how they put it in engineering term. You understand? It's something we need to eradicate errors. And one advice I will keep saying is health is wealth, and let's try to stay safe. Until our next show, for now, stay tuned.